virtual office hours. Our topic today is going to be the Hawaii Immunization Registry, HIR, inventory, and ordering. Let me just turn off this transcription. Okay, Kealohi, can you go to the next slide? Thanks. So some housekeeping, please mute yourself when you're not speaking. And reminder for the QA team, please monitor the chat for any questions you may be able to answer. And for the attendees, today's session is being recorded. Slides and webinar recordings will be uploaded to the website listed there. And to be added to the Hawaii VFC program email list, if you're not currently on there, please email your request to hawaiivfc@doh.hawaii.gov. In the subject line of your email, please write email list and your provider name and your PIN number. Next slide. And for questions during today's webinar, please use the chat to ask your questions so that our subject matter experts can respond directly. We'll be saving your questions to answer till the end of the presentation. And now for our presenter today on HIR and vaccine ordering through HIR and inventory will be Kealohi. She's part of our QA team, one of our site visit assessors.
Okay, thanks, Joe. Hi, everybody. Thank you for joining us. So just some important information and updates recently for the VFC program ordering side. Effective immediately, we are no longer going to be accepting paper VFC vaccine orders. That's either via fax or email, with the exception of allocated vaccines, meaning COVID-19, seasonal influenza, birthing hospital VFC nirsevimab, and special projects. That'll include birthing hospital, Hep B, and HBIG. Separate order forms are available for those vaccines, and those will be submitted via paper. But all other VFC vaccine orders are going to be only via HIR. And then just a reminder, you should have received an email about this prior to the holiday season beginning, but VFC vaccine shipments will be restricted to priority orders only, or it's going to be completely unavailable from December 13th to the 29th. So that day is tomorrow. I will tell you that we have been having some delivery issues, especially for our outer island providers. So we are working with our distributors to try to figure out what's going on, but just note that regular VFC vaccine shipping schedules are expected to resume beginning the first week of January. However, because of the order backlogs and the buildup over the holiday season at the vaccine distribution centers, the shipment delays could extend well into January. As we have already entered our re-enrollment process, so Hawaii VFC provider participation in the Hawaii Immunization Registry HIR system is mandatory. Providers must re-enroll in HIR via the HIR website between November 15th and January 31st. You can refer to your 2024 re-enrollment packet for step-by-step guidance on the HIR enrollment process. And then any kind of HIR technical issues or enrollment issues, you can go ahead and contact the HIR help desk at the numbers listed below or at their email listed here. First, we're going to just go over logging into HIR. If you haven't logged in before, it's just a brief overview. This is the login page. You can find the link here. And then you're going to go ahead and enter your org code, which is your VFC PIN number, and then your username and password. If you don't think that you were ever issued a username or set up a password, you can go ahead and contact HIR. You can also contact them if you want to get other staff members or other coordinators at your location access to HIRs so they can also place orders or do other things that HIR allows you to do. So the first part about ordering on HIR is recording your inventory. You must record or report your current inventory on hand prior to placing any VFC vaccine order. This is similar to the paper order form. We used to require you to write in all the vaccines you had on hand before placing your order. So it's kind of the same thing. So when you get into HIR, you're going to see a blue pane on the side, and then you are going to locate the option to record your inventory. If you click on it, you'll be taken to this page right here where you will enter your new inventory on hand. Once you do that, you're going to see it populate here. This was Macy Westbrook. She was handling the HIR ordering and inventory training sessions. So this is just a dummy example. So once you click on the Enter New Inventory button, you're going to be taken to this page here. It's going to list all the active vaccine you currently should have on hand. You're going to report any doses given since your last inventory, and then also the physical inventory you have in your stock at that point. The next step is going to be recording your actual inventory. You might notice that in these columns right here, it might not reflect the actual number that you had reported prior. That's an HIR issue. We are working to kind of get HIR more mobile and get it more user-friendly. But for right now and for ordering purposes, we're just going to really just bring it down to the simple steps. So you're going to focus on these two columns, which is the doses given and then the physical inventory. If you don't see a vaccine with your current lot number or expiration date, or for whatever reason, there's also an option to manually enter your vaccine. You'll go ahead, put in the trade name, package description, NDC, lot number, expiration date, and how much you have. Oftentimes, this manual entry option can be for vaccines such as TB or PPSV 23, the ones that aren't usually ordered by all of our providers. So the next step is just please be sure to enter all vaccine that you have in stock, all that you've used, all the different lot numbers. Try not to leave anything out because we really want an accurate and just an accurate count on what you have to make sure that you're not over ordering, make sure you're not under ordering, and we can go ahead and get that process. So once you've entered all your inventory and reviewed it to ensure its accuracy, you can go ahead, save and submit. If you're not ready to save, to submit it, you can just go ahead and save and return to it later. If you press the cancel button, that'll take you back to the previous page. Unfortunately, you will have to start again if you press cancel. So once you hit save and submit, you are going to get a pop-up that's going to ask you if you'd like to continue, and you're going to go ahead and select OK. And then once you've submitted your inventory, you'll be told that your inventory was successfully saved and submitted right here. You're going to click cancel to return to the previous page, or you can click print screen to print your inventory list to keep on hand. Clicking cancel may sound like it's going to cancel the whole process, but cancel is kind of used synonymously with the back button in HIR. So oftentimes it'll just take you back to the previous page you were on. So just the final step is confirming that your inventory was recorded. This is not an actual date, but it will tell you the date that you recorded it and whether or not it was submitted or if it was just saved. Once you recorded your inventory, you can go ahead and place an actual order. To do that, you're going to locate on the left-hand side, again, manage orders. And then if you click on that, you'll be taken to the following page where you will place your order. This option, create order, is not going to be, you can't click on it if you didn't record your inventory first. It's going to be grayed out. It's not even something that you're going to be able to click on. So that's kind of another indication that you need to record your inventory. In this page, you can also edit any delivery days or hours that your location might need to change. If for whatever reason you're no longer able to accept vaccine on a certain day, you can go ahead and change that here. So if you're ready to place your order, you click on create order. And then once everything is confirmed, it'll take you to the next page. And this is a page where you're gonna input the number of doses that you'd like for each vaccine. Please be mindful of the doses per package column. When placing your order, you don't want to accidentally order an amount you didn't mean to. Once you're ready to submit, you're going to go ahead and review and click Submit Order. You're going to get another confirmation pop-up that's going to ask you if you're sure you want to submit, and you're going to click OK. And then once that goes through, it'll populate into HIR, and you're going to see it. It should be the first entry here, and the status will be pending. Once it's in that pending stage, us on the VFC side are going to get a notification that it's ready for processing. And we will put that through if all other order requirements have been received. If you need to edit the order for whatever reason or cancel it, if it's still in this pending stage, you can go ahead and click on pending, and it'll take you back to the original page where you can either add to your order or cancel your order. And then if you do make changes, you want to make sure to submit the order again. Just a few reminders. You want to make sure to submit your monthly temperature log still to our email, hawaiivfc@doh.hawaii.gov. Failure to submit your logs will result in your order being delayed. So that is a requirement we're asking you to submit prior to ordering, just to kind of expedite this process. We want to be able to process your orders as soon as we get them, as opposed to having to reach out to you to get your logs in. You must report or record your inventory prior to submitting a VFC order, and you should aim to record inventory and submit your order at the same time. The way that HIR works, if you were to record your inventory on one day and then come back another day and want to put your order in, the inventory that you recorded is not going to be active. So you're going to have to record inventory all over again in order to get the ordering function working. And then also, this is just to ensure timely processing of your order. If everything is in at one time, we can go ahead and process. And then please be sure to update any contact information as well as delivery days and times. We really want to make sure that providers or staff are available for receiving shipments, to ensure that nothing is delivered on the wrong day and the risk of spoiling the vaccine. That's definitely something we care strongly about. Oh, sorry. Oh no. So that kind of wraps it up. For any VFC ordering questions, you can contact anyone on this list. This is our ordering team. Any one of us can help guide you through any questions you might have. For technical login issues, we're going to ask that you please contact the registry help desk at the numbers listed here, or you can shoot them an email and then they can walk you through what the next steps are for login issues. And then outside of ordering, for any VFC related questions or concerns, you can feel free to contact any member of our VFC QA team, which all of our contact information is here. And you can also find it in your toolkits or online on our online toolkit. That kind of wraps things up for ordering and inventory. Anybody have any questions? If you wanted to pop it in the chat, or if you wanted to unmute yourself and ask a question, you can go ahead. No questions.
Can you go over delivery days for neighbor island providers?
Oh, yeah, sorry about that. For neighbor island providers, because the way that McKesson, our distributor, ships out, they have a 2-day ship. So typically it's on Mondays. So providers on neighbor islands need to have at least, well, you can actually only receive vaccine Wednesday through Friday. So at least one day for at least 4 hours, Wednesday through Friday, somebody needs to be available to receive vaccine. And that's specific to McKesson's shipments for outer islands. Anything else? Yeah. No.
And if you have not attended the HIR training as of yet, this will count as HIR training. So if you could type in your name, location number, and location pin in this chat, so that we know who you are and we can count your attendance. Just anything else?
For those of you who have joined us late, this has been recorded, and we're going to upload it to our DOH website. So you can go ahead and take a look, go back to it, refer. There are some other videos on there that you can refer to as well. But yes, thank you for joining. If you could please use the following link to complete a satisfaction survey, just so we can kind of gauge how our providers are liking this. If you guys want to talk about anything specific related to VFC, or if you have any suggestions or comments, we would definitely love to hear from you.
Any other questions? We will be, our virtual office hours are usually on Tuesdays from 8 a.m. to 10 a.m. So if you do have any questions, one of us will be available until 10 a.m. this morning. You can just shoot us a message through the chat box, or you can hop on if you wanted to do a video discussion.
Joe, someone is asking for the survey link to be put in the chat.
Okay. Let me see. We will have the slides. We can pop the slides in the chat. Let me see if I can grab it. Hang on. Let me see if I can pop it.
I have the link, Joe.
Oh, okay. Thank you. Can you pop the slides in the link too? I mean, in the chat too. Thanks. We're also going to add the link to access our videos, our virtual, our educational videos. And I guess that's it for today. If you guys don't have any other questions.
Yeah. Thank you for joining us.
Yeah, thank you so much. Have a good day. And like I said, we will be available until 10.